Minister, I know from our work on the Health Committee together that you're well aware of the urgent crisis that we have on drug deaths in this country. We have very high levels of injury due to the use of illicit drugs. One of the tools in combating risk of death and injury is to use drugs such as Naloxone to stabilise someone during a usage crisis or an overdose. Ireland currently regulates Naloxone in such a way as to make it very difficult for users practically and for service providers and clinical staff to access. Other countries have started to look at the regulation of Naloxone, and given that Ireland has some of the highest levels of drug deaths in the European Union, we should really be leading the way here. Naloxone is a medicine that rapidly reverses an opioid overdose. It's an opioid antagonist. This means that it attaches to opioid receptors and reverses and blocks the effects of other opioids. Essentially, that means it has no opioid effect in and of itself, and I could pick it up off the ground, or I could find it and I could take it, and it would have absolutely no effect on somebody who hasn't taken an opioid. But for a person in addiction experiencing overdose, Naloxone can quickly restore normal breathing if their breathing has slowed or stopped because of that overdose. Again, Naloxone has no effect on someone who does not have opioids in their system. It's not a treatment for opioid use disorder. It has no street value, but it can be used in overdose crises, including heroin, fentanyl, oxycodone, hydrocodone, codeine and morphine. Naloxone can be given to any person who shows signs of an opioid overdose or when an overdose is even suspected. In Ireland, it's often given as a nasal spray, and in cases of nitazenes, which is the new danger, the new thing that we all fear, it now increasingly seems that we need maybe 3 to 4 doses of Naloxone to combat an overdose. So you can imagine how strong nitazenes are in that case, but people often simply can't access the drug in time. At the Committee on Drugs Use in September, the huge importance of Naloxone was discussed with both the Irish Pharmacy Union and the Irish College of GPs. Both organisations were clear in their support for reviewing access to Naloxone. I want to be careful not to miscategorise anything that they say on the issue, so I'm going to quote what they said. For the GPs, at the ICGP, and this is a quote, "We fully recognise the excellent safety profile of Naloxone, so we would be very supportive of removing prescription requirements." And from the Irish Pharmacy Union, when I asked if Naloxone was an issue and access to it was an issue, they agreed and said this is where we would have to go back to our Irish Medicines Board, the IMB, laws with regarding to making the drug no longer require a prescription. I put it to them at that meeting that we've undertaken defibrillators across the country where you can access it with a code on the street, and actually that was a suggestion that they engaged with, and that is the kind of level of access that we want. In England, prior to the UK's departure from the EU, so while they were still within the EU, it introduced a measure whereby persons could walk into any pharmacy and get the drug without a prescription. Anyone could access it that way. Ideally, this is the way that the product would be accessed, that you wouldn't need a prescription, that any family member, any friend of somebody who is living in addiction, and of course anybody working in drug services could access Naloxone. I am aware that this is not just a domestic issue in terms of legislation, but also an EU issue. But what I would like to see is Ireland really leading the way here. Yesterday, the Committee on Drugs Use published their interim report, and it was very, very strong on the issue of Naloxone. You know yourself that that report is very much based on the person and the experience of drugs from the actual user. This is absolutely about saving lives. The change in the law is very small here, but I would really urge the Minister and the Department to act now if possible.
Thank you very much, Deputy. I welcome the opportunity to inform the House on the current position relating to Naloxone. A strategic priority in the National Drug Strategy is to develop integrated care pathways and harm reduction responses for high-risk drug users, including people who are homeless, offenders, stimulant users and injecting drug users, so as to achieve better health outcomes and to reduce drug-induced deaths. The Health Research Board recently reported that 354 drug-induced deaths were recorded in 2021. This is 85 fewer deaths than in 2020 and represents a reduction of 19%. Now, the reason why the figures are 2021 is because of inquests, etc. There is that 2-year delay in getting the figures. Opioids are responsible for 7 in 10 deaths in 2021 and continue to play a major role in drug poisoning deaths. I believe that these tragic deaths could have been prevented. Reducing the risk of drug overdose require robust public health responses such as safer injecting facilities, more treatment services, greater access to naloxone and better awareness about the risks and consequences of drug use. Getting more people with problematic drug use into treatment is a key step in reducing the risk of drug overdose. And just on the supervised injecting facility, we're hoping to have that open by mid-December in Merchants Quay in Dublin. The Department of Health is providing over 160 million per annum on measures to treat problematic drug use. A major component of this funding is to enhance access to and delivery of drug services in the community through HSE addiction services, drug and alcohol task forces and community-based service providers. As a result of this additional investment, the number of cases entering the drug treatment has greatly increased in recent years. In 2023, there were 13,104 cases in treatment, a 50% increase compared to 2017. Naloxone is a prescriptive-only medication that is used as an antidote to temporarily reverse the effects of opioid drugs, heroin, morphine, methadone and synthetic opioids if someone overdoses. The Department of Health works closely with the HSE National Naloxone Oversight Quality Assurance Group to increase awareness and accessibility of naloxone. It is important that naloxone is accessible to support workers, peers and family members. I would like to acknowledge the group's work and assure them of my continued support. The introduction of the Medicinal Products Prescription and Control of Supply Amendment No. 3 Regulation Statutory Instrument No. 238 of 2023, which was in May 2023, allowed the Health Service Executive to approve courses for persons who may supply and administer naloxone in an emergency. In 2023, over 2,000 people participated in overdose awareness and naloxone administration training. Over 6,500 units of naloxone were supplied by the HSE to services in 2023, and already over 4,000 units were supplied by the end of July this year. Pharmacists who have undertaken appropriate training can already administer naloxone for opioid overdoses. The HSE and the pharmacy regulator have recently taken steps to make the training more accessible for pharmacists. And I'm committed to expanding the naloxone programme to further mitigate the use of drug overdose deaths linked with opioid use. And just can I finally say, just in relation to the figures that you're referring to at European level, those figures are the figures that we should really be comparing with is Scotland, because they have the same system for accumulating and gathering the information. For instance, you take in Germany, not all of the information is gathered, and there is a view that only about 1/3 of the cases are actually reported. Thanks.
Thank you for some of those facts and figures, and I do recognise that there has been a move by the department to increase the access to naloxone, but I'd like to give you an example of what it's like for service workers on the ground at the moment and how bizarre the current situation actually is. So we have made naloxone available to workers, but if I work in the drug sector as, say, a youth worker or somebody in Merchants Quay, and if I know somebody who I think might go into overdose imminently, who is at a level of addiction where I believe that they will or have gone into overdose, I need to go to a GP. I need to get a prescription for that person. If I then meet someone else who's in the middle of an overdose on the street in my work as a drug service worker, and I then decide to save their life and give them naloxone, I then have to go back to the GP and get a prescription for that and a new prescription for the other person that was the original prescription. Family members can't get access to it at all unless, so if you're living with somebody who's in addiction, they're desperately trying to keep their loved ones alive. And they can't really access it. Now, they can sign something to say that the family member takes drugs and therefore should get naloxone, but they can't access it on behalf of somebody else. That system doesn't lend itself to emergencies. And considering that it's a drug that has no impact on individuals who haven't taken opioids, who might take it for no reason, and has effectively no street value, and all of the medical experts in the area and the service workers in the area are telling us that they need access more freely to naloxone. It should be prescription free. It seems like we should be the ones moving as a government towards making that a reality. Approximately 70% of drug-related deaths are opioid based. That's where naloxone is most effective, and in general research would tell us that 4 out of 10 Only 4 out of 10 people who are experiencing overdose die alone. That means that for 6 out of 10 people, there was somebody there who could have saved their lives. We should be doing absolutely everything we can to stop drug deaths, and naloxone is part of that.
Over 2,000 people participated in overdose awareness and naloxone administration training in 2023, and the work in relation to having more people trained in the administration of it, but also in the availability. As I said, over 6,000 units were given out last year. 4,000 units by July of this year, in the first 6 months of this year alone, were made available. And it is available where we believe that there is a need for that availability to be there. The International Overdose Awareness Day on 30th of August provided an opportunity both to remember those who have died because of drug overdose and raise awareness of stigma and preventative measures. I acknowledge that the grief felt by families by the death of a loved one due to a drug poisoning, and I welcome the reduction in the number of drug-induced deaths. I want to acknowledge the contribution of drug services to this outcome. To reduce harm and prevent overdose, we need to encourage people to get medical help if they feel unwell or suicidal after using drugs, and not to hesitate or delay because of stigma and fear. It is also important that services are available locally when needed. I'm pleased that over 4.2 million in additional funding has been secured in Budget 2025 for new drug initiatives. This includes 4 million for harm reduction initiatives, including a rapid response to the threat of synthetic opioids, a wastewater drug surveillance programme, and extended opening hours for the supervised injection facility in Dublin city centre. In order to continue to reduce deaths from overdose, I am committed to ensuring that naloxone is accessible to services, families, emergency service and Garda Síochána. And I think it's important that, to understand that, the department and the HSE want to do everything possible to make naloxone available where the likelihood is that a person may be overdosing. And I think, the issue that you raised about the number of people who've died while alone is still extremely high, where no one can get access to them, and that's something that we need to work on to make sure that people can get access to services in a timely manner. Thank you.